and we have a reasonable projection of the disease outbreak in the country today. We have seen that community spread has entrenched in various parts of the country, and our multidisciplinary, multi-sectoral teams have been working countrywide to ensure that they detect early these cases, isolate them, manage them either under supervision in homes or if they're symptomatic in our hospitals. And the outcomes have been impressive. It is important to state here today that the response from the community to the call by President Edgar Chagolungu to wear masks, to wash hands, and to watch the distance as you interact in public has been commendable. It is for this reason that we are seeing in many parts of the country cases reducing. Now, as the President calls for us to reset to a new normal, we must emphasize the need for us to observe those 3 W's. Wear a mask, wash your hands, watch your distance. We must cautiously return to normalcy. And the only way we're going to do this is to ensure public health measures are in place as we get back to our normal. Covid-19 is still with us, and Covid-19 needs to be fought, and we must ensure that delicate balance between the economy running, averting hunger and poverty, allowing key areas of our livelihoods to be running normally, and preventing a public health crisis. This is only possible with collective moral discipline, with collective action. If all of us wore masks, if all of us washed our hands, all of us watched the distance as we are conducting business in public, if all of us ensured public health measures in our workplaces, we would be able to bring COVID-19 to a halt sooner than later. This week, towards the end of the week, we are expecting the President of the Republic of Zambia, His Excellency Dr. Edgar Chagolungu, to again provide guidance on the next steps in our COVID-19 response. The call today is to ensure that we maintain the measures that have been in place. The call today is to ensure that we learn lessons from areas that have been cautiously eased, and we look at how the pandemic has been evolving. We will continue implementing the scalable plan informed by the evolution of the pandemic, but the call to action is enhanced community action. We further want to thank the community for the high levels of alertness. We have seen increased numbers of alerts that have been reported to the Ministry of Health, and rapid response teams have been responding to these alerts. That is important in surveillance. So COVID-19 pandemic continues to have significant negative impact on our socio-economic and health status of countries globally. As we implement various measures to the pandemic, let us remain conscious of that need to maintain the balance, to reduce the stress on the economy, and also to ensure that our people do not suffer from COVID-19 and die. The Minister of Health would like to place on record appreciation of all stakeholders that have worked with government or other stakeholders in the multi-sectoral approach that have worked together to develop guidelines for the easing of various aspects of our livelihoods. Like I said earlier on, more guidance will be provided towards the end of the week as the President addresses the nation again. But the premise to that address is that we will incorporate practical adjustments to our livelihoods to ensure that balance between improved economic activity and averting a COVID-19 crisis. Countrymen and women, members of the press, in the last 7 days, we have recorded 182 new cases of COVID-19 out of a total of 9,275 tests. Western Province has recorded its first 9 cases. The new cases broken down include 26 community members. That is 22 out of Nakonde, 2 out of Chingola, 1 in Chilabombwe, and 1 in Senga Hill. Again, 17 were non-contacts. From Lusaka, that was 13, and from Kafue, that was 3, and Kalulushi, 1. We did record 2 cases of health workers in Ndola, and 36 were recorded out of the facility-based surveillance routine screening, and these included 20 from Lusaka, 6 from Mundola, 5 from Mongo, Kaoma 2, Sananga 1, Susheke 1, Chingola 1. And at our point of entry at the KK International Airport, 3. Out of the mass screening that we conducted in various parts of the country, particularly Chilawombe, Kitwe, Lusaka, we got 54. And 44 truck drivers from Nakonde, Livingstone, Chilawombe, and Chirundu. It is also unfortunate that out of the 9 cases that we got from Western Province, 1 died. So the deceased who died in Lewanika General Hospital had an underlying medical condition, and the sample collected during the routine review did test positive to COVID-19. A total of 154 patients from our isolation facilities have been discharged in the last 7 days. Therefore, that brings the total number of cases countrywide to date 1,382 out of the 45,248 tests conducted so far. Deaths are now at 11, and recoveries are at 1,142. All the patients that are in our various facilities remain stable. A glimpse into the global picture shows that we have now reached 7,995,877 COVID-19 cases, including 435,598 deaths. So far, 4,128,318 recoveries have been confirmed from 213 countries, territories, and 2 conveyances as at 8 o'clock this morning. Back home in Africa, we've recorded 235,704 cases, including 6,283 deaths. In the southern region, where we record as the hub for the Africa Center for Disease Control, we have recorded 73,635 cases with 1,515 deaths, while 40,280 have recovered. Countrymen and women, the Ministry of Health continues to scale up its response to COVID-19, and will continue to focus on the fundamental pillars that include improved surveillance at all ports of entry and in our communities and health facilities for the purpose of detecting cases early. This also includes a ramped up testing capacity. We've now set up more testing sites countrywide. We'll continue conducting robust contact tracing in the various parts of the country. And as we return to our normal daily activities, you'll see more testing points and more public health measures implemented there as part of the reset normal. We will continue working with our colleagues in various departments to ensure that public health measures such as hand washing, physical distancing are implemented. You will see in your various jurisdictions community teams that will be looking at those individuals who are under self-isolation, that will be managing those from their homes, and those that will be doing screening and testing. All our district health management teams working under the DCs, under the district epidemic control teams, will improve management of these activities. Disinfection is key, so infection prevention and control remains fundamental, and a call to all districts continue with the President Lungu's call for keep Zambia clean and healthy. That is a very high impact investment in the fight against COVID-19. As we update on the special operations that we've carried out so far, the Copperbelt province, with a total number of tests done standing at 5,598 in samples, we have seen a significant drop in the number of cases in the last few days. The operation focused on certain hotspots. One, points of entry such as Kasumbalesa, markets, truck stops, the mining companies, and selected boarding schools. Key populations were also sampled, such as truck drivers, clearing agents, border officials, and marketeers and traders of the general public. If we look at Nakonde district, another hotspot, in the last 7 days, we recorded 50 new cases, and a total of 597 cases so far have been confirmed in Nakonde, with no fatalities so far. In Chirundu, the targeted screening and testing has continued, with the number of cases standing at 52, 48 of whom are truck drivers. In Kafue, we've continued to monitor the situation and have continued to record lesser and lesser cases because of the adherence to public health measures by the community. A targeted operation at Comesa Market did bring out 5 positive cases out of 386 people sampled. We've continued to work with our colleagues in the Ministry of Education to strengthen school health activities, and we want to assure the public that government, in a whole government approach, is doing everything possible to ensure that schools and other public places are safe for all of us. Zambia, being a member of the African Union and other continental bodies, has continued to participate in coordination meetings and in various cross-border activities. And one key coordination meeting that has been taking place started today between Zambia and Zimbabwe and will last from June 15th to June 19th. This meeting is being supported by the International Organization for Migration, and it is aimed at strengthening cross-border collaboration. Cross-border collaboration will be key in the fight against COVID-19. As we move towards the end, let me emphasize that the government of His Excellency President Edgar Chagwa Lungu remains committed to improving the health of citizens of Zambia. We will not only focus on fighting public health emergencies, that is just but one key area of our health system reforms, but we'll continue looking at universal health coverage. So as we do all this, our focus still remains on malaria, TB, HIV, and many other communicable diseases and non-communicable diseases. Therefore, we will continue emphasizing resilience in our health systems by keeping those public health areas as a high focus. We want to thank our cooperating partners who have come on board to support the COVID-19 response, the business community that has worked with us and supported this response overwhelmingly, the community for being very responsive. We want to thank the health workers and other frontline personnel for their dedication to duty, their commitment to the COVID-19 response, and some along the line of duty have even gotten infected. We want to thank you for your patriotism. I urge again all of us to adhere to the clarion call by His Excellency President Lungu to reset to the new normal by embracing public health measures as we cautiously ease restrictions informed by the evolution of the pandemic. Therefore, I will emphasize wearing a mask, washing your hands, and watching your distance, and ensuring that as we do public gatherings, those other public health measures are in place. Let us ensure again that we minimize unnecessary travel to hotspots. Our patients who are at high risk, those with underlying conditions, those with challenges with immunity, the very elderly, we need to protect them. Remember, now we're in the cold season, and we have seen that in other jurisdictions, the cold season has come with its own challenges in line with COVID-19. Therefore, keep warm and keep those who are vulnerable at home. Keep warm, keep those who are at high risk at home. As you keep home and warm, this is the season that our hospitals record high rates of burns. Let us ensure again we protect those children that we're keeping at home from burns. As we try to keep warm by using fire, we have also seen in the past a spike in burns with very high mortality. So let us protect the children as we keep them warm and home. And those who are elderly and with underlying medical conditions, let us report such to authorities if they are in public, and let us also ensure that we take measures to protect them. May God bless Zambia with wellness, good health, and fruitfulness. I thank you.
That was an update by Honorable Minister of Health, Dr. Chitalu Chilufya, on the COVID situation in the country. 182 cases in the past 7 days, which is 1 week. We now take this opportunity to open up the floor for the members of the media to make clarifications. We'll take 3 questions at a time. Please, 1 question per person. So I'll take the first 3. The floor is open for questions. Okay, I can see a hand. Please come through to the mic.
Good afternoon, Honorable Minister. It's good to have you back. My name is Nchimunyangandu from Diamond Television. It's over 2 weeks now since schools resumed, those that are in examination classes. Basically, I would want to find out if tests are being done in these schools, because we believe that in South Africa, which is not far away from here, they did reopen schools, and unfortunately, some of the pupils got infected. And I believe that with the number of cases that we continue to increase, to record rather, schools are also vulnerable to that. Are we going to start conducting tests for schools? Thank you.
Thank you. Chinchimunya. Do we have any other questions? For this round, Honorable Minister, it seems there was only one question. Maybe you can take that one up, Honorable Minister.
Thank you very much. Like I alluded to earlier on, the government is implementing a scalable plan. It's adjustable, upwards, downwards, and it is informed by the evolution of the pandemic. Returning to normalcy is an imperative we will not escape, as we've already projected that COVID will be with us for a long time. But it is important that that balance is struck to ensure that key areas such as education and other areas of the economy are managed well without increasing the risk of the public to getting COVID-19. We've started with examination classes, and we are monitoring the situation in schools, working with our colleagues in the Ministry of Education. We've ramped up our school health programs, public health measures are in place, and all schools are in zones that are attached to particular DHMTs or clinics. Therefore, our watchful eye is on the schools as the examination classes continue. We will be analyzing as the pandemic evolves, and this is an adjustable plan. The tempo could be raised, reduced, or reduced. So all is subject to the indication or the information that we get from the evolution of the pandemic, and also from the public health measures that we're implementing. So we are sensitive and alert to what's going on in the region, but we have defined our own epidemic and are watching what is going on within the country. With a watchful eye, we will ensure that the scalable and adjustable plan is adjusted accordingly, informed by the evolution. What are we doing in our various schools? We are doing vitals. We've put up various hand washing points. We're emphasizing physical distancing. Should there be any child with a raised fever or with symptoms, the nearest facilities are available for rapid response teams to attend to them, and also for appropriate tests to be done. So measures are being put in place in a multi-sectoral manner to ensure that school children are protected. And like I said, through a watchful eye, we will be getting the nation informed on further measures.
Thank you so much, Honorable Minister, for that comprehensive answer to the question that we had. Do we have any more questions? Chimunya, you still want to come back? Then there's another hand there. Yeah, please, you can come through.
Good afternoon. My name is Ruth Kanyanga Kamu from ZNBC. Mine is actually a follow-up to the many donations and pledges that have been made towards the fight for COVID-19. And in particular, I would like to find out, I think if I'm not mistaken, on the 15th of April, Trade Kings made one of the biggest donations to the Ministry of Health to an amount of 28 million kwacha. I would like to find out how much of that has been delivered so far.
Chimnyangando, once again from Diamond TV. Minister would want to find out some of the successes that the Ministry of Health has recorded regarding interventions in the fight against COVID-19, because I believe that the first time that I did pose a similar question on if we were waiting on other jurisdictions to maybe find the vaccine before we could embark on anything. You did mention that we were not idle, as also our own researchers were working over the same thing. Then my second question is regarding what I would simply call, or what we are calling the new normal. We have discovered that despite the message that has been sent out there on people adhering to the COVID-19 preventive measures, it seems like people out there, the public out there, no longer take this fight so serious. On Saturday evening, just out of curiosity and the nature of my job, together with my team, we went out to just basically try to find out how people are living their lives now under the new normal. But unfortunately, some, I would say, named places, drinking places, it was business as usual. No proper masks and everything. People now think this is a hoax, and we are no longer in any COVID situation. Just basically maybe your emphasis and how people should handle themselves, because you did warn us that coming into this cold season, which we are in now, you've continued to talk about it, it's going to be very terrible if we don't protect ourselves.
Thank you so much, Honorable Minister. Maybe you can take up that last set of questions.
Well, thank you very much. Trade Kings are here with us, and they will be updating the nation on the donation that they generously did. And they will be talking to us about the donation in kind that they did. And Trade Kings made that donation and identified with us key areas of support. So it is not 28 million kwacha cash that went to the Ministry of Health, but 28 million kwacha worth of support in areas that were mutually identified, and Trade Kings has now started bringing in the equipment and other necessities to COVID-19, a significant contribution to the COVID-19 response. And therefore, Trade Kings will be given the opportunity today to give an update and hand over some of the high-impact equipment that they've brought into the country. COVID-19 still poses as a huge public health threat. COVID-19 is still here with us, and it is not time to be complacent. It is not time to rule out COVID-19 as a minor illness. The success in the fight against COVID-19 hinges on us as a community collectively adhering to the public health measures. We've been guided several times. The President has spelled out guidelines to the nation on how we are going to manage COVID-19. We need to adhere to the public health measures. And I want to give a message of hope to the nation today, that if we adhere to public health measures, we will not have COVID-19 ravage our livelihoods. The converse is also true. If we relax prematurely the measures that we've put up, and you stop masking up and ignoring the need for physical distancing, and you stop maintaining high levels of hygiene, we could still see a spike, and that spike could still result in a number of deaths. So it is important that we wear masks, wash our hands, and watch our distances. As we return to normalcy, we need to ensure public health measures are put in place. We have repeatedly stated that the cold weather poses a unique threat to this response. That's why we are emphasizing in this cold weather to ramp up public health measures to ensure that, in addition to what we've said, we keep warm. It is important to protect the most vulnerable, and we will see success if we adhere to that. What research, what success have we seen in COVID-19 response? Number one, from inception, the health systems were configured in a manner to respond to a public health threat. And that again has to be attributed to the transformational agenda that President Lungu embarked on in the health sector prior, establishing a health security system that was alert enough to detect any public health threats. That's the initial success. Second success is a good plan, multi-sectoral and disciplinary in nature, that was highly sensitive in its surveillance and being able to detect cases in the communities at various ports of entry. Detection of these cases early formed one of the reasons why outcomes were good. Ability to manage them successfully, resulting in a very high recovery rate of more than 80%, is yet another success that we should talk about. We must also emphasize that research has been ramped up, and we are doing clinical trials for various drugs that we've been using in response. And some of these research programs that we've been doing include prophylaxis research, seroprevalence surveys, and treatment research, like I said earlier on. We've also seen that there's been collaboration globally at regional and continental level, and our staff have participated in many programs at global and regional level. Zambia, the good leadership of His Excellency President Lungu has been identified, and Zambia sits on the continental body of the Africa Union that looks at the COVID response. So in all this, it is important to pitch the political will as extremely important, and in Zambia we boast of political will at the summit. And the President has led from the front line, and this is the reason why we've seen success. But like I said earlier on, it is not time for us to start celebrating success. It is time for us to sustain the gains and to push towards halting the COVID-19 outbreak. A number of cases that we were seeing when we ramped up our testing were alarming, but with increased testing, we're still seeing a reduced number of cases. That's a huge success. The hotspots that we had in Lusaka, Kafue, Nakonde, Kopabel, they're all quietening. With us sustaining these gains, we'll be able to move towards stopping COVID-19. And like I said, the low mortality and the good recovery is part of the success. If you look at defining and understanding our own epidemic, we've already picked the people who are very vulnerable. The population demographics, we've already seen that the key drivers of this infection are certain members of the community, and we are targeting our response towards that. The ability to leverage resources, to coordinate with cooperating partners has been a huge factor in this response. So again, I'll use the opportunity to thank the cooperating partners led by the United States of America, the United Nations, the British government, the Japanese government, the Chinese government, the Global Fund, the Swedish government, the EU and the World Bank, the business community. And in Zambia, we need to identify the leadership and support that we got from the Association of the Asian Community in Zambia, Indian Community in Zambia. So we thank all stakeholders and principally the community that have participated in this response, because they are part of the success story that we are talking about as we speak about the success stories behind COVID. Thank you so much for...
Thank you so much, Honorable, for that update. That wraps up our question and answer session. But we still continue receiving support, Honorable Minister, as you just mentioned in your closing remarks, from our various cooperating partners. And today we have in our midst donors who have come to make pronouncements here. We've got Lumwana Barry Gold. I think if they could start coming over to Mike to give their statement. Lumwana Barry Gold came in earlier and they have come back again. And then we've got Zambia Breweries with DHL. Please ready yourself after Lumwana Barrick. Then we've got the Zambia Industrial and Commercial Bank. We've got AHF. And then we've got individuals. And in this case, the youth are actually participating. So at this time, I call upon Lumwana Barry Gold to just come and make their statement.
Good afternoon, Honorable Ministers. Good to see you back. On behalf of Lumwana Mining Company, I'm here to hand over another consignment of the materials that we have donated. But before I do that, I just wanted to respond to one of the journalists who asked how the help has been used. I'd like to confirm to you, Minister, that on 26 May this year, we did hand over the bulk of our support.
Currently happening there.